Today, we're going to look at the history of surfactant and how it completely changed survival for premature babies. Hi, my name's Lisa. I'm an experienced NICU nurse educator, and today we're going to have a little history lesson. All right, you may not know this, but in 1963, President John F. Kennedy's son Patrick was born 5 weeks early. He died 39 hours later from what was called hyaline membrane disease. That's what we call respiratory distress syndrome now, or RDS. At that time, there was no treatment. Preemies simply couldn't make enough surfactant, right? That lubrication that's needed around the alveoli to keep their tiny little air sacs from collapsing. And remember, he was probably like a 34-weeker. I'm not talking about a tiny little 24-weeker. This 34-weeker is a baby we would expect to do well in the NICU today. Maybe not even come if you know me well. The death of JFK's premature son Patrick spurred President Kennedy to increase national funding for prematurity research, particularly respiratory distress syndrome. This presidential action resulted in increased NIH funding for neonatal research and the development of neonatal medicine, leading to innovation like infant ventilators and pulmonary surfactant. Let that sink in. Did you know that? JFK, he did it. By the 1980s, researchers began testing ways to give surfactant directly into the lungs of premature babies. The results were so dramatic that the trials couldn't really be blinded, right? Like doctors, nurses, respiratory therapists immediately could tell which babies had received it. Within minutes, oxygen levels improved, breathing stabilized, and survival rates rose. What was once almost always fatal became highly treatable, and now we see younger and younger babies surviving. Today, surfactant therapy is the standard in every NICU, and we've even developed less invasive ways to protect the fragile lungs. I think this story matters because it shows how truly young the NICU is, how research and innovation can completely rewrite the future for our tiniest patients. And I bet it's something that you didn't know or put together between JFK's son and our current use of surfactant. So I hope you've enjoyed this little history lesson, and just know that the NICU is still so young. There's still so much for us to learn, and I hope you're going to be part of that.